Thank you, Madam Chair. These comments might be slightly longer than yesterday. First, I just want to acknowledge and thank you for your leadership of this committee and for your many years of leading Article 2 work group over your career, and for your advice, and certainly was very thoughtful and helpful in fashioning this Article 2 product. You know better than most how challenging this can be. I also want to give my sincere thanks to the members of the work group, Senators Birdwell, Senators Colhurst, Uresti, and Watson, as well as the healthcare work group that you appointed at the very beginning. Senator Huffman, Senator Colhurst, Senator Nichols, Senator Whitmire, Senator Uresti, and Senator Watson. We also had participation from other members. Senator West came in on issues concerning DFPS, and I just can't tell you how I appreciate the many countless hours we've spent together these past several weeks, or how I value the attention everyone's paid to the issues and the contributions that have been offered to make this product what it is today. Each of y'all have brought a unique and valuable perspective to some of the most important issues facing our state. I also want to thank, obviously, the staffs of everybody as well in LBB. Members, as you know, the Article 2 agencies provide services to some of our most state's vulnerable citizens: foster children, individuals with mental health illnesses, the elderly and the infirm, and those with physical and intellectual disabilities. However, in a challenging budgetary cycle, such as the one we currently face, difficult decisions must be made in order to ensure these individuals' needs are met in an appropriate and responsible manner. By narrowing our focus to those priorities which are truly essential to the people of Texas, and by pursuing measures designed to improve quality and efficiency, I believe we have been able to present to you, the chair, and the members of this committee with a product that not only meets the needs of our citizens, but also advances a number of key priorities. And members, I can tell you, to a person in the work group, the priorities for this session centered around CPS and foster care systems, as well as mental health. The Article 2 work group product first recommends addressing our foster care capacity crisis by significantly increasing foster care rates in the legacy system and the community-based care model, including establishing a new intense plus level of care and a treatment foster care model. Second, members, the work group recommendations include the continuation of the critical needs funding initiated during the interim, as well as additional funding to reduce conservatorship caseloads in our foster care system to a 1:17 caseload ratio. Third, the work group recommendations will expand community-based care to 4 new regions of the state over the next biennium and provide funding to ensure interoperability between DFPS and the single source continuing contractors. Madam Chair, regarding mental health, the work group recommendations maintain inpatient mental health capacity both at our state hospitals as well as our contracted beds across the state, and add maximum security beds to address our forensic wait list. In addition, Madam Chair, in Article 9, special provisions and members to keep the discussion about infrastructure needs in our mental health system as well as deferred maintenance concerns, there is a more detailed rider and further illustration of the concerns of members and issues that need to be addressed regarding deferred maintenance and our state mental hospitals in Article 9 that we'll be seeing here real shortly as well. Finally, the recommendations of the work group will maintain waiver slots for individuals with intellectual and developmental disabilities at the levels anticipated to be filled at the end of FY17, and will add 276 additional slots for children aging out of foster care or transitioning from general residential operations. That, members, I know this plan doesn't reflect every priority that you would like to see funded in our Health and Human Services budget over the next 2 years. And truth be told, there are a number of issues and areas I would have liked to have personally invested more resources. However, just like the people of Texas, we must live within our means. With that said, I believe the product before you represents a responsible budget that will meet the Health and Human Services needs of Texans and address the most pressing issues we will face in the coming biennium. Thank you, Madam Chair.
Thank you.